everybody, it's Heather Manley with another short video to add to the Cardiac Rhythm Interpretation Toolkit. This one's going to go over the 5 steps that we use to figure out what rhythm your patient's in. Let's get started.
We use 5 steps to interpret the rhythm that our patient's in. The first thing you're going to want to do is print a strip. You're going to want to look at 6 seconds. You can see on this strip here, the 3 hash marks at the top circled in black indicate that this is a 6-second strip. The next thing you want to look at is the QRS complexes. Count them up and multiply by 10, and that'll give you about what your patient's heart rate is. In this picture, it's 70. After we look at our patient's rate, we want to look at their rhythm and is it regular. We can see if it's regular by marching out the QRS complexes. And you go down your strip and you see that they all line up. And they do. You can do the same thing with the P waves. Put a hash mark in the center of your P's and move it down your strip and see that they all line up. You'll all learn how to do these intervals on the central monitor, but it's always a good idea to print it out so you can look at it and see that the PR, which we're going to do now, the PR interval, is the same. And it doesn't change. That's important to know. Sometimes it's hard to see if you only measure one beat on the central monitor when you're doing your intervals for your shift. It's always better to print out a 6-second strip just to make sure that they're all the same. And all these small boxes in the large big box, they're 0.04, and there's 4 of them here. So this PR interval is 0.16. And we're going to look at the QRS complex. And that is 2 small boxes. So this QRS complex is 0.08. Then we look at the QT, and do the T wave there. And that's 2 large boxes. So this QT is 0.40. So there. Now we know that our patient's rhythm is regular and their intervals are all within normal. We know that the rhythm that we just looked at is normal sinus rhythm because the rhythm is regular. The rate's between 60 and 100. There's a P wave before every QRS complex. The PR interval is between 0.12 and 0.20, and the QRS complex is between 0.05 and 0.12. Those are the 5 steps that we use to interpret our patient's rhythm. The last thing I want to talk about on this video is the importance of the QT interval. Normal is 0.44 or less, and a prolonged QT can increase a patient's risk of polymorphic ventricular tachycardia. A large majority of our patient population is at increased risk. Renal failure, heart failure, and liver failure all increase a patient's risk, and a lot of the medications that we give can prolong the QT interval. Some antibiotics, antiemetics, antiarrhythmics, and even some antifungals can prolong the QT. You want to look at trends. If you did the QT interval 3 days ago and it was 0.44, but tonight it's 0.56, that's significant and you'd want to make the provider aware. These are the important points to rhythm interpretation. I hope you all found this video helpful. Thanks for watching. Bye.